Hello and welcome, prospective Year 12s. So, unfortunately, I know some of you have not been able to join. So, therefore, just to talk you through what health and social care at the Wren looks like. Um, so, what do we do and what will you learn? I think they're the key things to sort of introduce you to. So, here at the Wren, we cover 6 units. It is the equivalent of 1 A level. And the course that we are doing is the OCR Cambridge Technicals Level 3 in Health and Social Care. So there are 4 compulsory units, and there are those 4 units are the first unit, which we do in Year 12, is building positive relationships. And this is a coursework-based unit. Everything you will do will be in class, and we will do it together. Unit 2 is the equality, diversity and rights in health, social care and childcare settings. And that is an hour-and-a-half exam, which you will sit in Year 13. Unit 3 again is health, safety and security, and that again is an hour-and-a-half exam. And Unit 4 is anatomy and physiology, and this is a 2-hour exam, and you will sit that in June of Year 12. We then have 2 optional units which we have chosen, which are supporting people with mental health conditions and public health. Now, the reason we've chosen these units is obviously given the year that we had, it has been a very challenging year, and mental health conditions are at the forefront of not just the newspapers, but the things that we are hearing about and reading about every day. And it is going to be an issue which you going in potentially into healthcare workplaces, this could be a big issue that you are coming across daily. Public health is dealing with things, obviously, I will talk about each of these individually, but it's basically thinking about things like your hand washing that was being promoted during COVID, and it was at its height. So they're the 6 units that we cover. So we do these units, we do 1 coursework and 3 exams in Year 12. So now, that sounds like a lot. You're not actually going to do 3 exams in Year 12. We're going to do 1 exam in Year 12, but we are going to prepare for 3 exam units in Year 12. So first of all, Unit 1, which is about building positive relationships and the importance of relationships in health and social care, and how important those jobs are. We are then going to do Unit 4, which is looking at the body, the structure, the functions, everyday things that our body do that we don't even really think about. So things like our, hearing, our eyes, our heart, all of the things our body are doing, and understanding what happens when there is a problem, what happens when there's a malfunction with that, and how that can impact our lives. Particularly, as people are getting older, these things are much more things like cardiovascular disease and things like that. It is a much more pronounced things that will happen to your body. So they're the 2 units that we cover from the beginning of Year 12. And Unit 4 is quite a big unit. It does take a lot of time, and it is quite a complex unit. There is a lot about the body. Unit 1 is mainly coursework based. So we then, from about Easter of Year 12, we'll start Unit 2 and Unit 3. Now, we are preparing, we are not doing exams at this point. We are going to do preparation for your sort of understanding Unit 2 and Unit 3. So Unit 2 is about the implications of diversity and discrimination in the workplace. So thinking about, the individuals who use the services, so the service users themselves, the people providing care, and the employers and the employees, and why it is so important to have things like legislation and national initiatives in place to support people and to protect people from anti-discriminatory practices. Legislation is quite a complicated thing, and we will do lots of focusing on this. Again, with Unit 3, legislation is a hugely important thing because we are dealing with health and safety, and so there are lots of rules and regulations around health and safety, particularly ensuring that you understand safe working practices and why they're so important. Both of these exams, Unit 2 and Unit 3, will be sat in January of 2023. We will start them in after Easter, but you will do the exams in January. They are both an hour and a half long. Unit for Year 13, this is an entirely coursework based year, and we are going to do Unit 17, which is about supporting people with mental health conditions, ensuring they have their own care and support suitable for their individual needs. Understanding different types of mental health conditions and how they impact individuals, and understanding how everyone's needs are different, even under the same bracket of a particular mental health condition. Then we are going to do Unit 24, which is the public health strategies and initiatives. So that's thinking about things like the hand washing policy, what these kinds of things, the implication for the, of the health policy for the wider population. These are both coursework units, and we will aim to finish them for roughly February, March time, with plenty of time for lots of revision for any additional resits or anything that we have to do. There will be lots of feedback on your coursework, although you will not be able to be given specific feedback. You will be given a rough guide of what needs to be done to help improve. So how will the exams work? So just to really make sure that you understand how the exams work, the Unit 4 exam, which is the only one that you will sit in Year 12, will be in June of 2022. You will then do Unit 2 and Unit 3, which are the diversity and the health and safety units, and they will be done in January 2023. Now, in January of 2023, sorry, you are then able to do potentially a resit for Unit 4 if you would need one. The hope is obviously we wouldn't need one, but we then have that opportunity because it is quite a complex unit. We have that opportunity for resit should we need it. So you will have then 2 resit opportunities for Unit 4. They will be January and June of 2023. Now, Unit 2 and Unit 3, you will be able to do a resit in June of 2023 should you need it. Hopefully none of you will need it, and therefore it is just an option just in case. There are coursework deadlines, and there will be lots of very clear, distinct deadlines that you will work towards. And there will be some manoeuvrability in terms of ensuring that we understand the coursework and that that you are doing your best. Just some of the things that I think it would be really good for you to start preparing. So there are lots of videos and things on Netflix that I would recommend as really good places to start really getting an understanding of health and social care. Now, some of them will not be relevant to what we are studying, but it is good to know the wider aspects. So, for example, whilst we won't be doing sexual production unit on sexual health, things like what to expect when you're expecting and call the midwife are really good, particularly for those of you who wish to go into careers which are dealing specifically with things like midwifery. There are lots and lots of programs. These are just a few. I would recommend you watch. I've also taken some from that are beyond Netflix. So, for example, thinking from BBC iPlayer, some really good ones on Amazon Prime, and some really good ones on 4 on Demand. Now, they're all very different. They're all dealing with lots of different things, but they are all to do with health and social care, and they can be really informative and really interesting to watch. Same goes with the reading, which I'm going to share with you now. These are some of the books which are again, which I would recommend. Some of these have been made into films. So The Hate U Give is a film dealing with racial tensions and things like that. But there are some really good films. I'm just going to move this bubble out the way so you can see. But yeah, there are lots of books. What I would like you to do, if possible, and I have, is to keep a record of the reading that you do over the summer. In terms of helping with health and social care, it is really good for you to have that background and to be reading more and starting to really think about what is it you want to do with health and social care. Is it that you want to become a carer? Is it that you want to become a doctor? Is it that you want to go on and do occupational therapy? There are so many limitless opportunities. So please do read, do lots of reading, do lots of watching, and really take advantage of some of the titles that I've given you there. There are lots more I can recommend. Benefit Street might be what might sound like a really funny program, but it is a really good one to watch for thinking about the way that we view social background, how people are treated, that kind of thing. So it's really interesting and well worth. And I would like you, if you to take a learning log and to really complete a diary of what you are reading. You can also include newspapers and magazines and any additional reading and watching you do. For example, Benefit Street, like I said, is a really good one you can add. And thinking about, how does that help you prepare for the course? So please do take this opportunity to do some reading. You will be very busy come September, and so therefore, whilst I would love to say that you'll get lots of time to watch programs, you are going to be busy. So now is a really good opportunity to get ahead. What I would like you to do is think about some health and social care related words that you could come up with. Had we been doing this live together, we would have sort of thought of these words together. But there are so many, and it's really good for you to start building a glossary of words to do with health and social care. And I am going to leave it there. If you do have any questions at all, please don't hesitate to email me, drop me any questions. Anything that I can do, I will absolutely do. And please do feel free to drop me an email. My email is cmclean@ren.excalibur.org.uk. You should be able to find it on the school website. But as I said, if there is anything I can do, if you want a little bit more information about the course we do, you will all get an online textbook when you start with me in September. But obviously, I am looking forward to seeing you all, and I am really looking forward to learning with you our health and social care. So good luck for your GCSE results, and I am looking forward to seeing you all in September. Good luck. Thank you.